2 pills in 2 days. The FDA authorizing new treatments this week to help fight COVID-19. Thanks so much for joining us this evening. I'm Marlisa Goldsmith. Now, there are a lot of questions surrounding the 2 pills, so THV 11's Ian Russell turned to the experts for answers.
By this point, you've heard the news that 2 different COVID-19 pills have been approved. Pfizer's pill was approved on Wednesday, with another pill made by Merck and Ridgeback Biotherapeutics approved just a day later. Like with most new things like these treatments, people have a lot of questions. What does it do? When can I get it? And can it stop COVID? Dr. Madison Schuler is a pharmacist at Westside Pharmacy in Benton. We took some of those questions to her to find out what you need to know about the 2 pills.
Yeah, so with these, we're really trying to prevent hospitalizations. That's the main goal here. So it's for people with mild to moderate COVID. Possibly those who are at risk of progressing to hospitalization. We want to prioritize the higher risk patients.
Both pills don't stop the virus, but they do help lessen the symptoms. Merck's pill, meant to be taken by those 18 and older, reportedly lowers the risk of hospitalization or death by 30%, while Pfizer's, which is for those 12 and up, reports theirs lowers that by 89%. But how do they work? Both pills do the same thing. They stop the virus from replicating itself, but they target different things to make that happen. And for both pills, Dr. Schuler says getting them in your system within 5 days of first symptoms is key.
Be able to recognize those signs and symptoms of COVID so that if they do start to feel bad, they can get that test early and so we can get them treated. Because 5 days is not a huge window, and we really want to get them treated fast.
And if you're wondering when these pills will be available in Central Arkansas, so is Dr. Schuler. She says based on talks they've had with the Arkansas Department of Health, we're looking at sometime next week or right after the first of the year. But don't expect supply to be available right away. Dr. Schuler says they'll be extremely limited at first. Back to you.
In the first week, Arkansas has already received 480 treatment courses of Pfizer's antiviral pill. But Dr. Schuler says expect these pills to arrive in areas harder hit by COVID before anywhere else. And something else to remember here, you will need a prescription to get each pill.